before I start, I'm going to say that when Kevin asked me, I thought, I can only talk for 6 minutes. So it was a challenge to get down to 20 pictures and think about 6 minutes and 40 seconds. And I commend the ones who spoke before me. So I'm Syexwáliya, and my great-grandfather Jericho's on the far left, and his sister Iamshalot in front. Far right is the Iamshalot's son Kwatayath, Jimmy. And this is late 1800s, where healthcare was all about our ethnobotany and being able to live. My grandparents, Sequalton, Dominic, Charlie, and Josephine, when they were married in 1913, they were just here at the start of Vancouver, and the healthcare was just a doctor probably in one woodshed, and then came up to being cared for and teaching all of us, their daughter in the center and my daughter there and all my nieces and nephews and grandchildren. And our hope, my hope for healthcare is that my family gets taken care of in a good way, that my grandchildren here, Kirsten, Jordan, and Shanalta, Gavin, that they know that they can go into a hospital and be given treatment that everyone else in the province gets and not be stereotyped because of who they are and where they come from. And that they, along with my Shanalta Gavin, who I've helped raise, and his mom and his dad, that he doesn't face the trouble and traumas that his mom's experienced going into an emergency ward and being told, do you drink, do you use drugs? And my son, Max Sequalton, that he can have the care he needs in programs to get on a good, healthy road to recovery and be understood about what his problems are and be helped along the way. My mom, who's now 80 years old, who thanks to the health care had a stroke, and a doctor that I knew said this is what she needs, and she needs to be taken care of and given the right prescriptions and care, so that she's 80 now, that we have her for a while. That young children like this, and this is the young lady who I won my hat from that I'm wearing today, and in a raffle. And so that they can grow up and know that the young brother that was just born can be cared for. My 3 daughters, my brother cousins, 2 daughters, and my daughter Josephine. Jojo went into the emergency, and like I started to say, was asked if she had drinking or drugs. And we, through physical activity, realized we need to work hard towards being fit physically. And, you know, she had to have her gallbladder removed. And they tried to 3 times send her home, and I had to go back and say, something's wrong with her. And they finally found out it was her gallbladder. And these young children are under 16. The oldest in that canoe is probably 13. The youngest is 8 years old. And it's being able to take what we've learned from our ancestors and live it today and within our traditional territory, hike the mountains, and hope that there's programs in health to continue having good activities to get my grandson Shanalta Gavin out of, you know, get him playing basketball or get him doing something so that he's not sitting there always on his PS4 and Xbox One. Because he's 12 now and he's 5'11". And he's still got a lot of growing to do. And what I hope for healthcare is that you're all respectful to First Nations people and ensure them treatment and not have any stereotype about who we are. and that, you know, we need good health care, and that we can't speak up for ourselves, and that you're an advocate for those First Nations people who come into your emergency room or in your clinic, and that you're there so that they can keep smiling like my daughter and know that she's alive today because I went in and said that you do something now. And like when I went into emergency with a broken wrist, they said, oh, you're all right, and you do need surgery. Here's a splint, go home, we'll call you. I didn't get called for 4 days, and I ended up needing this steel plate with 5 pins. And I had to have an emergency doctor advocate before they called me. And this is some of our council. Our council believes in the leadership, that we listen to our people and that we're advocates, that we have the best health care that we can get, and speak to you about how that health care is. And by working in collaboration with the First Nations Health Authority and sharing who we are and where we come from. Because Jericho Beach is named after my great-grandfather, who you saw in the first picture, and that we're always going to be here. And a belief in that you can mentor. For healthcare, our hope is you'll mentor and allow people to get educated and graduate to be the nurses and the doctors. My granddaughter wants to be a doctor, and so I'm encouraging her to go on. And through our culture, my grandson Chinaltzit is learning the culture, because we have to know that to walk strongly in this other world that we have to live in. And that's our hope for healthcare, that you realize we live in 2 worlds and you need to understand it. Thank you.